So Heather, is it safe to take blue Cohosh during pregnancy? What do we need to know?
So there's a lot of things to look at because pregnancy is obviously 9, 10 months. So at the beginning of pregnancy, no, I would not take blue Cohosh. It can cause contractions, which can cause a miscarriage. So stay away from it early in pregnancy.
Check your supplements, make sure nothing you're taking has blue Cohosh in it early on.
But at the end of pregnancy, it can be very beneficial. So there are many supplements that moms can take, like labor prep formulas, cervix softeners, those sort of things, those herbal concoctions that can help prepare the uterus and prepare the body for an easier labor.
Mm-hmm.
And in many of those, blue Cohosh is an ingredient. So this is something that we hear a lot from women. My doctor said don't take it, or my midwife said don't take it. I'm concerned. So I decided to do a really deep dive into this. Now, before I tell you what I found out, the creator of Sunstone Formulas, she did a whole article about blue Cohosh and the controversy with the research. So that is a great one to read. I believe it's on her website that you can go to and read it. We also have it on our Mighty Mama group, that it is one of our tagged posts that people can go to. But I said, okay, I want to figure this out. I really want to go into the actual studies and find out, because some things it's just all, cover yourself, just say no.
Right. Especially during pregnancy.
Exactly.
It's safer to say this is not safe to take during pregnancy, and then you don't have to worry.
Exactly. Yeah. So I started out, I thought, I'm going to ask ChatGPT so I don't have to scour the internet here. And I said, is it safe? And ChatGPT said no. And I said, okay, everyone says that, but I want to know why. So I spent about an hour arguing with ChatGPT and making it give me the research studies and looking those up and making sure they were legit, because ChatGPT lies and makes stuff up sometimes. And here's what I found. Basically, every study out there or every article refers to two specific studies is all.
Mm-hmm.
One study, it looked at a woman whose child had heart defects, except for she was also on cocaine.
Oh.
And cocaine can cause heart defects, heart problems in the fetus, in the neonate. And so you can't really take that study at face value because this woman was also taking cocaine.
So did this study focus mostly on just one woman, one case?
Yeah. It mainly focused on that.
Even that in and of itself is not a legitimate study.
Exactly. So she was the main part of this study. And it was just ridiculous because we know cocaine causes these problems. And you can't say, oh, well, it could be blue Cohosh. Like, really? That's not a study really at all.
Right.
So you have to take that study out.
Yeah.
So then I said, okay, what other studies are there? And there's some animal studies, but here's the thing. None of them say, yes, it causes these problems. They say, well, it could, it might, it's inconclusive, there's a possibility. Well, that doesn't help me either.
Mm-hmm.
So the other human study was very small. I'd have to look it up exactly, but I think it was 6 women. It was a very, very small study. And the numbers were insignificant, the separation between those that had heart issues and those that didn't. It was statistically insignificant. Mm-hmm. And they said, well, it could cause a problem here.
So let's be safe and just never, ever take it.
But they couldn't prove it.
Right.
And so if you really look at all of these studies, they will say things like, none of them say it does cause problems. They say it could, it might. We think maybe, like, there's nothing conclusive. And so it says, well, just to be safe, don't use it.
Right.
One of the big arguments they use is that it does raise estrogen levels. So they're like, well, it could cause a miscarriage. Well, at 38 weeks, that's not a miscarriage. That's labor.
Right.
It's birth. It does prepare. And so you really have to know how to tear apart these studies and understand them to see the bias. The other thing that they did is the study, the one I was talking about, that small study, not the cocaine study, but the other one.
We're not regarding that one.
We're not even
taking that
looking
into
at that one.
consideration.
There was no controls, meaning, okay, if you take 1 tablespoon or 2 tablespoons or 100 grams or 100 milligrams, or there was no definitive factor. It was just like, oh, well, you took it. Okay, well, how much did they take? How often did they take?
For how
long? None of that was put into the study. And so they said, oh, well, you took some, right? Well, yeah, but you didn't say how much or when or how pure it was or not.
Or what else you were taking.
Exactly. And so you can't, that's why the study says, well, maybe we think it might kind of, but we're not really sure. Because it wasn't really it wasn't a controlled study at all. They just said, oh, well, here are some women whose babies had heart defects. So what did they do?
What did they,
right.
Try to find like a common factor or something.
Exactly. And so it was just a very poorly done study that way.
But the problem is that midwives and doctors and ChatGPT and everyone is looking at that one study and being like, well, I'm not going to recommend it. I'm going to tell my mamas that they shouldn't take it because they don't want to take the risk. They recommended something that could potentially, possibly be. So can you explain to us why the history of blue cohosh being used in labor preparation? Because as you mentioned, Sunstone formulas, and the founder of that is not only a midwife, but a master herbalist.
Right.
She includes it in her formula. So why are we even talking about this?
So blue cohosh and black cohosh, actually, they are like the female herbs. They help with menopause, with infertility. They help with regulating cycles. And so they're very much known, along with vitex and chasteberry, very much known as the female herbs. And so that is a huge part of the reason they use it, because it helps with the hormones. Because when we are pregnant, our hormones are just all over the place. You know, our progesterone goes up, and then, you know, the placenta takes over and the estrogen is all over the place. I mean, just all of our hormones. That's why we're so pleasant when we're pregnant, because our hormones are just going crazy, flip-flopping back and forth and back and forth. And so blue cohosh can help with that equalization of hormones at the end of pregnancy to prepare for labor. So by the end of pregnancy, we're talking 35, 36, you know, kind of weeks. You start low, and then you build up as you become closer and closer to your due date. But that's why the blue cohosh is used, because it does bring on contractions because of the estrogen and the levels it produces. Where black cohosh, very interesting, can help even out contractions. So like if I have a mom that is having contractions back to back to back or irregular, black cohosh can even them out. So they kind of work almost like a yin and a yang kind of thing. And but blue cohosh just has really gotten a bad rap because of these 2 studies that are just not good. So you ask, okay, why doesn't anyone do a study? Well, why would a pharmaceutical company do a study on an herb that is going to bring them $0?
Right.
It's not. So you'd have to do a large study. You can't do it on 10 women or 20 women.
Right.
It's just too small of a study.
Useless.
Right. So you'd have to do it on hundreds, if not thousands of women to have it. And you'd have to find someone willing to sponsor it that would get no financial gain from it, because herbs can't be patented, and there's just not the financial gain from them.
Right. So instead, we're sort of looking at herbalists and midwives who've been using this for, how can we say, centuries? I mean, for a long time, they've known. And so that's not like an official study, though, that's been conducted with all the proper parameters and controls and everything. But they have recognized over time that this is an herb that helps with labor preparation. And then another thing I want to talk about is, okay, so one reason we're talking about this is because we recommend a labor prep formula that really has helped me a lot and helps a lot of women, because a lot of our mamas take this. So that you kind of reducing your chances of needing to be induced.
Right.
You're making it so that if you do have to be induced, your body's more ready so that it would go into labor faster if you do have to have a medical induction.
Well, and just kind of a more efficient labor where you don't have that prodromal
kind of a faster, smoother labor,
right.
which is absolutely ideal if you're wanting a low pain, comfortable, enjoyable labor.
Right.
But again, a lot of women are worried. So one more thing I wanted to talk about is the dosage, like in the formula that we recommend specifically, and others we can't specifically say to other formulas, but
right.
How big is this dose anyway? I mean, it's in there, it's on the ingredients list.
You know, honestly, I have never talked to the creators that make these formulas, so I don't know the exact dose. So I just know it's one of the many ingredients. And one thing that you should know on ingredient lists is the ingredients at the top are the ones that are the highest dose. And as you go down the list, the dosage is less and less and less. Mm-hmm. But they don't give me the exact dosage.
Right. So but I guess what I'm saying is just because it's in there, it doesn't mean you're taking pure blue Cohosh. You're not taking huge amounts. It's just part of this formula.
Right. And they work synergistically together. You know, it's that difference of taking vitamin C compared to just eating an orange. When you're taking just vitamin C, that's what you're getting is vitamin C. Mm-hmm. When you eat an orange, you're getting vitamin C and the riboflavin and all of the different things that come in an orange. So they work more synergistically together rather than just ascorbic acid. Mm-hmm. You know, so when you take rose hips, you're going to get more of that than just ascorbic acid. And that's kind of those concoctions or those formulas is they work synergistically together. Now, with that said, you should not take these if you have a history of really fast labors, even mm-hmm. if they don't have blue Cohosh, because there mm-hmm. are some brands that don't have it.
Right.
Do not take them if you have a labor less than 6 hours, like your previous birth. Do not take them if you have a history of preterm labor, either in previous pregnancies or in the current pregnancy. You should definitely not take blue Cohosh if you have struggled with high blood pressure. You know, you're on labetalol or some other medication for high blood pressure. Don't take blue Cohosh because it can raise your blood pressure. Mm-hmm. And so it's not worth the risk for your blood pressure that way. So there are a few times that we're like, hey, don't take it because of these things. But I have moms who have had 36, 37 week labors and they can still take it, but I don't have them start until 37 weeks mm-hmm. because they have a history of going early.
Right. So, and as always, we need to point out, we are not your healthcare providers and can't give you medical advice. So you still should check with your healthcare provider to see what they say because they know your medical history. We're just talking about, in general, blue Cohosh has gotten a bad rap by people who don't necessarily know that much about it.
Right.
And so you personally have to decide, let's say that your doctor says for no actual reason, but just because they've heard of the studies, no, you should never take blue Cohosh. And you personally have to still decide, am I going to do it or not? You know, for me in that position, because I did choose to take it, I was trusting the master herbalists who make these formulas with the history and the education that they have over maybe a doctor who doesn't have any education in that. But I'm not telling you not to follow your doctor's advice. I'm just saying everyone's going to make their own decision. And personally, that's something that I, would take into consideration.
Right. And a lot of people just err on the side of caution, which I understand.
Yes.
But, that goes into a whole different topic of why are all of these other medications okay that have been proven to potentially cause issues, but they're fine to take while you're pregnant. But we can't take this one that has 2 really crappy studies. So, there's bias. There's bias in everything. I knew a doctor that would tell all of his patients, don't do breast pumping to bring on labor because we can't control breast pumping. But Pitocin is fine because we can control the dose of Pitocin. Mm-hmm. And I was like, is he kidding me? Like, is he serious? And he was totally serious. And I just kind of was, just, oh my gosh, and that's kind of the blue Cohosh. It's when things are unknown and then they become fearful. Mm-hmm. So, use it with caution, but know that there is fear surrounding it that from what I can tell in all of my research is really not truly justified. Mm-hmm. Like no one has been able to prove definitively that there is a problem with it at all. It's all speculation and we think, and I don't go for that.
Okay.
Yeah.
Well, to wrap up, we will put a link below to Sunstone Formula's labor prep formula that we recommend, as long as you feel comfortable and your healthcare provider is on board with that. So you can check that out if you're interested in labor prep, and be sure to watch our next video.